I'm here in Shatta community, Rafinyashi, under Boso local government area in Niger State. I'm here on a visit, to a community clinic where a group of men are joining hands to save the lives of women giving birth. This woman labored for hours before she was able to birth this baby girl. In an unhygienic environment, a great number of women in Shatta come here to give birth. There is no provision for sterilization and infection control here. After birthing, the blood is thronged in a plastic toilet bowl using a local broom and plastic refuse pan. She has lost so much blood, roughly 5 pints, which is about 525 milliliters. Because a piece of the placenta remained in her uterus after delivery, she requires a blood transfusion. This hospital does not have a blood bank, so they apply direct blood transfusion after a few tests carried out with strips.
Pregnant women, we did antenatal. For my first time of coming here, we receive antenatal every day, more than 6 to 10 patients at every day. Mostly on Wednesday, we schedule antenatal schedule in Wednesday. We do receive like 15 to 20 sometimes. But if they face any health challenges, they have believed that the cultural treatment which affect them from denying from receive the health care services. We are liking of this immunization agents like tetanus toxins and other. After delivering, we are facing challenges of the OPV, BCG, OPV, PCV, IPV, and the measles, yellow fever, and HPV. So we are facing challenge because of issue of the condition of the light. But we have other government clinic nearing to us because it's controlled by this ward. This ward is called what? Shatta ward in Boso local government. They are holding of the freezer, refrigerator for the maintaining of the competence of the BCG, those vaccines. I take recourse to them that we used to get the highest number of the delivery here, but we don't have access to immunize them from BCG or OPV. I don't think they did not respond for us. 80% of the children are suffering from the malaria during the rainy season. Some in the villages, they believe malaria is caused by a winch or any thing, which lead to them to go for the herbal. Before coming to the clinic, it will look complicated. Some are anemia. But after they come to clinic for the anemic treatment, we hope we transfuse blood to them. But if you explain the materials need before transfusion, it will look costly for them. Due to the other treatment for the audience health workers that live in here, they didn't screen blood before transfusion. But if present now, as I'm posted to it, I try to explain how the blood should be screened before transfusion to them. They deny the causality of the screening, like HIV script, like hepatitis B, like hepatitis C, like the syphilis, and other, or if possible, malaria should be tested before transfusion, and other things. And group this thing, blood grouping, but they don't only know to buy blood bag and transfer to their to their other patient. For me, I didn't do that. Because if it's getting worse, I will just refer them to general hospital. Because if they reach that general hospital, they will listen to their information more than here as a village. Because they cannot comply with you because they think we are in village. But in general hospital, they don't have opportunity to even argue with the doctor or any other person. They'll just write what they do to them, how they'll respond quicker than a village. So that's the challenges we are facing here.
Before going to school, I was here in this clinic for just 10 years ago. Because I stayed for one clinic for 5 years, here just like 6 to 7 years. So that one is just experience that those my ogas are telling me that this is how I go do, this is how I go do. That is where I gain my own experience to help them with this thing. If problem of pain, you get problem for the pain. As in, maybe you enter there and see how, if you look my body, you see how I look like, you know. Sometimes people are just coming here, as you see how I do that work. I finish the work, everything. The baby is normal, the woman is small. Person go if you tell me, say, you give me 1.5. Even though I say I know we collect 1.5, they could become a dragging together with the man who carry the patient come. So, you know, we are here to just helping them. Not be say we are collecting money, much money from them. The person will understand us. If you say now, you give me 5,000 naira, person will just say, okay, you give me 4,000. Okay, you know that the man give experience. Okay, if I say you should give me 2,000 or 3,000, tell me say you will give me 1,000. You know that in day there is not any this thing. So we are here to helping them. Not be say that the money where they talk with him, now then they will give us.
This is the primary healthcare facility in Shatta, deserted. Many are devoted to this clinic for their medical needs.
We serve in 24 hours. That is why they prefer to come to our clinic. Every time they come to our clinic, they must mix a staff. They will meet a staff presently. And this clinic is building an olden days. You can see the structure of the clinic. It's old. So they are first utilizing this clinic before government to providing others clinic. To this area of the death, we still maintain antenatal 300 naira. If there's not any complication or order to fix drips, because drips is up to 1,000 naira now presently. But up to now, we still give routine draws of 300 naira. If the pregnant woman doesn't have any much complaint.
Na gwamnati na wani lokaci ba sa kwana a gurin, ba sa zuwa wurin aiki da wuri, kuma ka san mutane kawai wani lokaci muna zuwa gona. Mun fi so mu zo mu samu aikin sharp mu samu tare da doctor a gurin, sannan shi yasa muke jin daɗin zuwa wurin asibitin.
Ba matsala. Ko bashi ya rage ne za ku bi na hankali mu biya ku.